Hi, everyone. Good morning. Today, we're joined by Dr. Brandon Webb to give a COVID-19 update on the state of Utah. It's been a little while since we've given this, so we're going to talk about how Utah has been doing with COVID-19 and the vaccines. Dr. Webb, thank you so much for joining us. It's nice to see you.
Thank you, Amanda.
So I'm going to start with case counts and what's been happening since the last time we spoke. These are yesterday's numbers. Yesterday's daily case count was 266, which is the first time we've been below 300 cases since June of last year. We unfortunately had 4 deaths yesterday, and our hospitalizations are at 139 people. As far as vaccine goes, we have given out 2,464,088 vaccines. Those that are fully vaccinated are at 1.4 million, and those that have just received the first dose are at 1.1 million. So it seems like we're doing pretty decent as far as vaccine goes. Let's talk a little bit about case trends and counts. How is that doing? What are you seeing in the hospitals right now?
Well, we're happy to announce that we have seen decreases in the numbers of cases, both hospitalized and also in the community. And going back to what you just reported on those vaccine numbers, if you look at the percentage of all Utahns who have received at least 1 dose of vaccine, we're at about 44% as of yesterday. And if you add to that the patients who have not yet been vaccinated but have recently had COVID-19 and have had natural immunity, that means that our herd immunity numbers are up above 50%. And that's terrific. It's not enough, but it's terrific. And we're seeing that reflected in the decreasing case counts in the community.
What about the variants? We talked a lot about variants at the beginning of this year. We were seeing a couple of variants popping up in Utah. Are we seeing any variants specifically coming out of India yet, or so far are things pretty contained?
So we have had some imported cases of COVID-19 in Utah from individuals who had traveled from India. And we're working closely with the Utah Public Health Laboratory to sequence and make sure that our surveillance safety net is woven tightly so that we can identify when those variants do come either from India or from Brazil or from other places in the world. Right now, they've been very few and far between. And by far, the variants that are dominant in Utah are the UK variant, which as far as we can tell, comprises about 60% of our cases, and the California variants.
And it doesn't seem like that's contributing too much to an increase of cases. So that seems like it's pretty doing okay as far as that goes, which is great to hear.
It is.
Is that pretty true?
Several months ago, we had a conversation and we talked about the race between vaccination and variants. And we're still in that race. But what we're seeing right now is that because vaccination numbers have actually been very good in the community, the vaccination side of things is edging out the variant side of things. The UK variant and the California strains could have resulted in much worse transmission at the state level, but haven't because so many Utahns have been vaccinated.
Well, that's great to hear. And speaking of vaccines, I want to talk a little bit about Intermountain Switch. We have been vaccinating people through a mass vaccination clinics at various hospitals, and we're now making the switch to pharmacy and medical group, which is our clinics, to better meet our consumer needs. Can you explain a little bit more about what this means for the public?
Yeah, this is great news. What this means is it's bringing vaccine access closer to Utahns and closer to the healthcare providers that Utahns know and trust. Not that the mass vaccination clinics were not run by trusted healthcare professionals, but I think in general, when making important decisions like should I get vaccinated, we tend to trust our primary care physician or our specialty providers with whom we have a relationship. And bringing the vaccination closer to patients and their established providers does exactly that. It allows patients who are still on the fence, who are making those really important personal decisions about should I be vaccinated? When should I be vaccinated? It puts that vaccination step closer to the providers that can help inform patients the best.
And this process is still the same to sign up. Intermountain is still accepting and recommending people go to our website currently. That might change eventually, but right now you can still schedule through the pharmacy and various clinics that way. And I think it's great that they're switching to this doctors, physicians first, because it allows people, like you said, to have this conversation who are still a little bit hesitant around the vaccine. So it sounds like we're moving, like you said, in the right direction, which is great to hear.
Yeah, it's particularly important, Amanda, as we now shift into the younger populations. We're getting primary care providers and pediatricians equipped with the ability to provide vaccination. And I think as parents are more comfortable with that type of a situation in general for getting their adolescents vaccinated.
Yes, that is very true. And parents do need to be with their child when they get the vaccine. So that probably does make it a little bit easier for them. The other thing I really wanted to talk about is masks. We've heard a lot about masks in the last couple of weeks. States are getting rid of their mask mandates. There's not one here in Utah anymore. And a lot of big corporate chains are also getting rid of their mandates in accordance with the CDC released around vaccinated people not needing to wear a mask. So that's all happened. Why does Intermountain still have a mask mandate in place in our facilities though?
Yeah, that is a great question. There are certain situations where, because we have patients and individuals in the community who are still vulnerable, who either have been vaccinated and maybe have not likely generated enough immunity from the vaccine to be fully protected, or who haven't had a chance to be vaccinated yet. Those individuals, when they're within the walls of their healthcare provider, we need to care for them and protect them. And so that's the reason why in healthcare settings at Intermountain and at other healthcare systems around the state, masks are still required. It's to protect those who are still susceptible.
Do you feel like there might be any sort of impact on maybe the case counts or anything of the like because people are no longer wearing masks? Do you feel like this is too soon, or what are your thoughts on what could potentially happen?
Well, Amanda, let's talk about why that announcement was made. Let's talk about the reasoning behind the CDC announcement. There were really several factors that went into it. One was, for months now, we've been watching the variant strains and the impact that those strains might have on transmission in the community. And before making any announcements that would loosen precautions, it was really important for public health officials to get a sense of whether those variant strains were going to cause significant spikes in our community transmission. So we needed to have that time period, those last 6 to 8 weeks, under our belt to understand what impact the variants would have before making any decisions about loosening public health measures. So that was one. Number two, we've been watching closely the vaccination rates over the last 6 to 8 weeks. And before making any decisions about loosening masking or distancing precautions, we needed to see that we were on track to achieve the numbers of vaccination that we need to get ultimately to really feel comfortable going back to a full normal. And we are moving in the right direction. Like I said, we've got 44% of all Utahns have had their at least one dose. And we are looking to achieve those numbers that have been proposed by the Biden administration to get up to at least 70% of individuals in the country who are eligible to have at least one dose by July 4th. So that's the second piece. The third piece were some important new real-world vaccine studies that have been published in the last few weeks. There are three scientific studies in particular that really help us understand how likely it is that someone who's fully vaccinated could be exposed to COVID-19, have the virus, and be shedding it and potentially transmit to others. And the good news is that all three of those studies were done in populations where they follow patients very closely. And they actually screen those individuals every week to see if they're shedding the virus. And in all three of those studies, which comprise a group of over 10,000 individuals, it looks like, as best we can tell, the chances of getting COVID-19 after having vaccination and not knowing it, being asymptomatic, is about 0.5%. And that's low and very reassuring. And another study suggested that if an individual does contract COVID-19 asymptomatically after being fully vaccinated, the amount of virus that they shed is 4 times lower than what we normally see in someone who's infected with COVID-19. So all of that new scientific evidence helps us to understand that the risk of transmitting the COVID-19 virus to someone after being fully vaccinated is very low. So taking those three pieces all into account, that's the reason why now we are seeing these public health recommendations loosen up in terms of mask wearing.
That's great to hear that there has been real world data and not just the clinical trials, which still gives us a lot of great data, but it's nice to see that it's kind of this bigger group that's being looked at. You mentioned this term too, viral shedding, and I want to just clarify something. I've heard a lot just of people talking about how after you get the vaccine, you're shedding the virus. And will you just talk about that rumor that's been out there about how you are not getting the live COVID virus when you're getting the vaccine and what it kind of is? Absolutely.
So none of the vaccine products that are currently available generate virus that can be shed. So that's a concern that's not grounded in the science of how the vaccines work. The vaccines actually, each of them stimulate an immune response to a part of the virus, but none of them are injecting individuals with the intact virus, and it's not possible to shed the SARS-CoV-2 virus after receiving either of the mRNA vaccine products or the Johnson & Johnson.
I want to talk a little bit about the variants and the vaccines. You mentioned the variants as opposed to the case trends and kind of what's been happening. Have we gotten any further data or information around the variants and the vaccine and how effective they are, specifically against potentially the India one? Has there been any real world data from that specifically?
Those studies are ongoing right now. There's a tremendous amount of attention being given to that within the scientific community. We do know that the vaccines are very effective against the strains that are currently circulating in the United States that are dominant, the California strains, the UK strain, even the New York strains. We know that the strains that are being identified elsewhere in the world, for example, the India strain, we understand which mutations those strains contain. And we're working with public health officials and the vaccine manufacturers to identify to what degree the immunity that these vaccines elicit will be active against those new variants like the Indian variant. We expect that, like the South African variant and the P1 variant from Brazil, that the vaccines that are currently available will generate immunity to those. It may not be as robust, but it will generate immunity. And again, in the race between vaccination and variants, some immunity goes a long way. So we still think that even if the immunity elicited by the vaccine is decreased, it will still be enough to get us to the goals, the public health goals that we're all targeting to get us back to the new normal.
I want to talk about the word FDA approval. There's also been a lot of conversations around how these vaccines are emergency use authorizations and not FDA approved. I know Pfizer is what did or was or currently is applying for FDA approval. Can you explain what that means and why these companies got emergency use authorizations versus a automatic FDA approval?
Yeah. So emergency use authorization is not a shortcut authorization. Emergency use authorization still requires very rigorous evaluation, both by the FDA, but also by other scientific bodies. And each of the 3 products that have received emergency use authorization in terms of vaccine have undergone very rigorous evaluation. They have not yet received full approval because the full approval process takes more time and requires additional experience with vaccination in the community in a real world setting. Those applications are underway, but had we waited for the old, the full approval, we would be behind the 8 ball and be losing the race between variants and vaccination. So I think it's really important to understand that emergency use authorization isn't a shortcut authorization. It's still a very rigorous approval process that the FDA has conducted. And the community can be confident that the EUA authorization is sufficient to give us confidence that these products have been tested and that they are continuing to be tested in real world settings. With now more than 200 million doses administered, we're getting a tremendous amount of information about the safety profile, the rare side effects, and the effectiveness of all 3 of the vaccine products.
Another question we just got was around the Indian variant and vaccines. If the vaccine is not as robust against the Indian strain, should we actually be relaxing masking?
So currently, I think it's important to recognize that the Indian strain is not dominant in the United States. And for the Indian strain to cause widespread infection, there would need to be enough individuals in our community, in our country, who are non-immune, who would be potentially susceptible to that strain. And again, in the race between vaccination and variants, we know that the vaccines that are currently available and are being deployed do generate enough immunity that it will provide a barrier if we can get to those goals that the Biden administration has proposed. If we can get to those goals, that will provide a barrier against any variants from other locations globally from becoming dominant in the US.
Another question for you. We talked about this a little bit earlier, but there's lots of corporations getting rid of their mask mandates. And I know that there's local companies here that are getting rid of them. They got rid of them this past weekend, and I went grocery shopping, and I personally am not quite comfortable enough taking off my mask. I have a little bit of anxiety about it. Do you have any advice for people? Are people still okay to wear them? What are your thoughts on that? How do you get more prepared to take off your mask if you're vaccinated?
Yeah, I think there's 2 questions there, Amanda. The first one is with some places in the community still requiring masks, others encouraging masks, some individuals in the community feeling much more comfortable taking their masks off, having been vaccinated. We're now in this patchwork quilt situation, and it can make people feel a little bit uncomfortable. I know I've experienced that, to be honest. I think it's really important as a community that we recognize we've now transitioned from mask mandates to personal responsibility and personal decision-making. And with that, it's really important as a community that we exercise a great deal of respect for others. If people are wearing masks, it's because they are choosing to take that additional layer of precaution. We don't know if someone's wearing a mask because they haven't had a chance to be vaccinated, because they might have had an organ transplant and their vaccine may not have generated very much immunity for them. We don't know. And it's important to just be respectful of the choices that others around us are making. On the flip side, Amanda, if you are healthy and you've been fully vaccinated, there is there is a psychological barrier to taking the mask off. There's sort of this safety net that masks have provided for us for many months now. It's become a habit. And I think it's important to recognize that for individuals who are healthy, who are fully vaccinated, the science does give us confidence that you are well protected and are able to enjoy many, many activities without a mask on. There are certain situations where people may still choose to wear masks, even if they're fully vaccinated. Those might be situations where they're around individuals who are known to be susceptible. If you have a loved one who's battling cancer or who has a problem with their immune system, you may still choose to wear a mask around that individual. And people who are at higher risk, for whom the vaccine may not be as effective, people who are of older age, who are obese, who have multiple medical problems, or whose immune system doesn't work very well, those individuals may choose appropriately to wear masks, especially in indoor settings or in areas where there are large amounts of people or poor ventilation. And I think it's important to remember that because there is some gray area around that, people may or may not be wearing masks, and we need to be respectful.
Great advice. Thank you for that. 2 more questions for you really quick. One is just any tip for parents who have children that are that 12 to 15 age group. What should they start to be doing right now besides scheduling their vaccines? Can their children start hanging out more together? Masks, no masks? Any general advice for that group?
Well, let me give a big pat on the back to Utah children in general. I think that Utah students have really led the way with doing what we needed to do to allow us to participate fully in in-person education and to do other activities that have been facilitated by mask wearing and by tests to participate. The kids have been great. And now we have an opportunity for 12 to 15-year-olds to get their vaccine. And I think we're seeing a lot of interest in that group. They now are looking at that as their ticket to being able to take their masks off and to do things that they haven't been able to do. And I'm very encouraged by that. As far as parents go, I am a parent of adolescents, of young teens. And we're excited for them to have the opportunity to be vaccinated and to start, taking those opportunities to be with groups of other kids as more and more adolescents are vaccinated without needing to follow as strict precautions. But it all depends on vaccination. Vaccination remains key.
And a general prediction overall for the months to come. Do you feel like we're in the clear with COVID-19 as summer is coming, so it's getting warmer, people will be outdoors more, which is great, but the fall will be here soon, which means flu will be here as well. Are doctors and physicians looking at that as something we're going to be taking into consideration? Has that conversation started at all with predictions for the fall?
Yeah, no, it's definitely top of mind, Amanda. What happens this summer will define what happens this fall. This summer is such an important opportunity for us as a community to keep our rates low and to increase our community vaccination rate, which is the only way that will prevent having a fall spike, is by getting through this glass ceiling, this sort of 50% ceiling, and getting up closer to 70% of individuals who are eligible vaccinated.
Well, thank you, Dr. Webb. It's been a great conversation and I really appreciate it. And if anyone is watching would like to get their vaccine and has not yet scheduled their appointment, they can go to intermountain.com/COVID vaccine. There's some great information in general that talks about the benefits of the vaccine and where you can also get it, as well as that scheduling tool. Again, Dr. Webb, thank you so much and have a great weekend.
Thank you all.